You are now listening to Appointment, a podcast dedicated to showcasing the very best direct primary care providers in your community. These guests are taking the initiative to transform how you receive your healthcare services by simplifying the process and improving how healthcare is done. Appointment is sponsored by AppAccess, helping independent healthcare providers and entrepreneurs take control of their online presence by better engaging their mobile audiences no matter where they are. Learn more at appaccessllc.com. I am your host, Jonathan Christopher, and let's get started. In today's episode of Appointment, I have the honor of interviewing Leslie Ware, who is a physician assistant that actually owns and operates Alpha Health and Wellness in Charlotte, North Carolina. It's particularly interesting for me because I am pursuing that profession. Let's hear her story. So, good morning, PA Ware.
Good morning.
Very fortunate to be interviewing you here at your well-designed practice. It's a beautiful setup you have.
Thank you very much. I'm excited to be here, and thank you so much for inviting me.
Definitely. How long have you been here in this? How long have you been, or a better place to start is, what is your practice? Tell us about your background. I know where you're in direct primary care, but
yes.
Tell me a little bit about how you got into it and what your avenue and what you're doing here.
Okay. Well, yes, that's a long story. I'll try and make short. But I've been a physician assistant for 20 years, and it's been mostly in primary care, internal medicine. So I've done a fair share of pediatric, but mostly adult medicine. Prior to becoming a PA, I studied as a health educator. So I've always tried to marry the health promotion and health education with health care and clinical practice. So I've done that in pretty much every setting you can imagine, except for inpatient. So I've worked in community health centers a lot of the time. And in that setting, you're taking care of folks who are uninsured or who are indigent, who have a lot of education to gain regarding their health choices. And so I really enjoy that. I've done diabetes and cardiovascular disease management and education. So I like to reach out to the community and be really involved with population health. So in working in the community health center setting, that really helped me to gain appreciation for how to take care of groups of people and look at healthcare outcomes at a greater level. And so the community health center setting is what I really enjoy. And that is sort of what gave me an appreciation for the cost of healthcare. I had to really become a bargain Betty in trying to help people to stay on medications that they need and to find other ways to manage their health than to be on a number of medications to manage each disease. So I've worked in community health centers. I've worked in private practice, specialty practice, and for large healthcare systems, corporate healthcare. Over time, I think it's just really the whole healthcare system has morphed into an industry that doesn't really serve the people as well as I would like for them to serve, including the healthcare providers. So about a year ago, I was experiencing a burnout like many healthcare professionals are, and was at a crossroads as to whether I was going to carry out the rest of my career in a different area of medicine versus, maybe I'll just throw in the towel and open up a coffee shop or something. So I had a friend introduce me to a physician who was working in his own practice. He himself had left insurance billing sort of setting and opened a direct primary care practice. And so I went to visit him, and he told me all about it and showed me his setup, and I was just really intrigued. I had already known about concierge medicine and thought, wow, that's really cool to be able to have a lower volume of patients in your practice that you can pay more intimate and particular attention to. But with concierge medicine, it's pretty pricey, and I don't know that many, wealthy people that I could have and build my patient panel, or I didn't feel I could. So I went to the Direct Primary Care Summit back in 2017 and learned all about it. And my goal there was to find out if it was feasible for me to be able to have this sort of a practice, if it was legal for physician assistants in North Carolina to have their own practice, and just to really kind of feel what it was all about, learn what it was all about. So I went, I had a great time. I learned a lot. And as the universe lined up for me, I met Dr. Brian Forrest, who is one of the thought leaders for direct primary care. And he does a lot of advocating and lobbying for our, insurance and legal sort of aspect of direct primary care. So I learned a lot from him, and I followed him around on the Hill and did some lobbying for the first time for a bill that was on the table. And I really came back with a great appreciation for it. And so that was in June of 2017. At the time, I was working at a practice that I was just certain that I was going to leave. And by that following May, I opened my practice. So May of 2018, I started Alpha Health and Wellness Direct Primary Care. And here I am. Now I'm in the process of building my patient panel and just learning all that I can about how to do this successfully.
That's awesome.
Yeah.
In the next installment of Appointment, PA Ware will share with us more about her patients, time, and over-medication. As always, I'm going to include details on how to contact my guests that are on the show in the show notes and in the links below, as well as how to contact me for any guests or any inquiries or any feedback that you may have to offer about the show. I'd look forward to hearing from you. Join in next time. I look forward to speaking with you again. Bye.